My name is Jonathan Beckel, and I'm going to tell you about our model of bladder pathology that uses lysosomal dysfunction to cause bladder hyperactivity and inflammation. I have nothing to disclose. So we all know that as we age, our chances of getting bladder pathology increase. For example, here's a study in 2001 that looked at the instance of overactive bladder in European population, showing that in both men and women, the instance of OAB increased up until about age 75. This article from 2000 looked at interstitial cystitis in the Japanese population, again showing a rise in the instance of pathology up until about the age of 70. This carries over into rodents, which we normally use as a model for these age-induced pathologies. Again, here in mice, both male and female, show an increased bladder hyperactivity, detrusor hyperactivity in the aged animals. And so the mechanism of these changes could be many things. It could be oxidative stress or genomic instability that are generally found in the aged population, as well as receptor plasticity and altered transmitter release, or structural changes in the bladder wall itself. So one other difference that we've been able to find is that the endolysosomes in the urothelium of these aged animals appears to be much larger than the endolysosomes in their young or adult counterparts. As you can see here, the fractional organelle volume or the total organelle volume appears to rise quite significantly in the aged animals as compared to the young. In these Fisher rats, and these aged rats are about 18 months old. So we thought that this probably indicated a deficit in lysosomal function. And so we all know that the lysosome needs to have an acidic pH to be able to do its job. And so we wanted to measure whether or not there was a deficit in this pH. And we were able to measure the endolysosomal pH in these in cells cultured from these animals. And you can see here that the young animals had a normal pH of around 4.5, whereas the aged animals, that pH rose to about 6. So this begged the question, could we artificially increase the lysosomal pH then to mimic bladder pathology? So to accomplish this, we can treat the urothelium with chloroquine, a lysosomotropic agent that gets into the lysosomes and increases its pH, or baflomycin A1, inhibitor of the VATPase pump that will prevent its acidification. And you can see here, if we treat cultured urothelial cells with baflomycin or chloroquine, we can increase their pH significantly. This results in the release of ATP from the urothelium, as well as the release of IL-1 beta and pro-inflammatory cytokine, which then made us ask, could we then treat rats in vivo with chloroquine to increase their lysosomal pH and mimic this age-induced bladder pathology? What we would hope would then result in bladder overactivity and inflammation. So if we instilled chloroquine intravesically into the bladders of rats, either acutely or daily up to 3 days, you can see that we had a significant excitation of bladder reflexes, as shown here in this, with a decrease in the intracontraction interval during cystometry. Additionally, intravesical administration of chloroquine induced bladder inflammation, which we measured through plasma extravasation, here showing that chloroquine, either 1 day or 3 days, significantly increased the amount of plasma extravasation from the bladder. So in conclusion, we can show that artificially raising the lysosomal pH using chloroquine or baflomycin induces the release of ATP and IL-1 beta, two known mediators of bladder hyperactivity and inflammation. And so then if we instilled that chloroquine intravesically, we could decrease bladder capacity in anesthetized rats, as well as increase bladder inflammation as measured by plasma extravasation. So we believe this model, which recapitulates the lysosomal dysfunction that we observed in the urothelium of aged rats, could be a powerful tool to replace aged rats in the study of bladder pathology, with aged rats being quite expensive to create or to maintain. This is a much easier way to show that bladder pathology. We'd like to acknowledge our funding here through the NIH and through the University of Pittsburgh's O'Brien Urology Research Center Summer Undergraduate Program, and to mention that we are currently looking for postdocs. If you are interested, please send me an email. Thank you very much.